Prevention is better than cure. Very good evening. Welcome to today's episode of BMC Global Live AL-HILAL Health World. Myself, VJ Marina Francis. As I mentioned in the beginning, prevention is definitely better than cure. And to prevent, we must first be aware. That is what is intended through this episode of Health World. And then after being aware, the journey from unhealthy to healthy is just a matter of lifestyle. Our today's topic is rectal bleed. Let's know more about the topic from the doctor joining with us today, a consultant in gastroenterology, Dr. Suresh D. He completed MBBS from Madras University, MD General Medicine from Dr. MGR Medical University, DM Gastroenterology from Dr. MGR Medical University. He is currently working at AL-HILAL Hospital, Muharraq branch. He is definitely the most suitable person for today's episode of Health World with his vast experience of 24 years. So let us welcome Doctor and hear more from him. Good evening, Doctor. Welcome to today's episode of Health World.
Thank you.
Thank you for being with us today.
Thank you.
So Doctor, as I always say, let me start with the basic question. What is rectal bleed? How can you define it?
Yes. See, the blood bleeding can occur in any part of the body. Either with injury or without injury, you can have a bleeding from any part of the body. But today, we would like to concentrate more on the bleeding in the rectum, which is the lowest part of the intestines. And why this bleeding is important is easily missed or easily detected late, easily not identified. It can expose a disease, sometimes innocent, sometimes very bad. That is why the rectal bleed is very, very important. Most of the time, it is picked up when you go to toilet. Now, many people in the flush type toilet may not even see their toilet closet, they just flush it and go out. Sometimes in your cloth you can have blood spots, or your tissue, if you use tissue paper, that may have a blood spot. Sometimes you look into the closet, then you may see a blood. Then it is very important. Once you detect whether it's one drop or streak or lot of blood, you see a bleeding in the rectum, it is very important to consult a doctor and get it thoroughly evaluated. Rectal bleed is not to be ignored or to be forgotten.
Okay, doctor. So now can you elaborate on the symptoms of this disease, the symptoms that the patient will show?
There are two things it can exhibit. One, as I told you first, you pick it up in the cloth or tissue paper or in the closet. Sometimes you don't notice it, you are fast, you are very busy, somehow you didn't pick it up. You may have slowly the signs of the bleeding, like tiredness, weakness, dizziness. Your eyes can become pale. Or the reasons for the bleed, there are multiple. Those diseases can produce symptoms like loose motion with blood, or loose motion itself, or constipation. You may have a constipation and slowly it's so difficult to pass motion, or there may be pain while passing the motion. In that stage you will come to doctor, I am not passing the motion and it's very painful when I am passing. That stage you might come out, or you may have a loose motion. I thought the food is causing the problem, but now occurrence is becoming, or subtle loss of weight or pain in the lower abdomen. All these ways of exposing is there. Or in rare occasions a doctor puts his finger into the rectum and checks and then sees the blood. The patient has never noticed it. These are the ways the patients can come to the doctor with or without rectal bleed.
Okay, doctor. So we heard that there are different kinds of symptoms in different patients. Now, how does this disease affect the health of the person in the short run or the long run?
Yes. One is the bleeding itself. You lose blood anywhere in the body, any causes, automatically the hemoglobin of the blood comes down, the blood level comes down, your performance, your strength, everything you can notice going down. You feel suddenly tired, you have some unexplained difficulties, fatigue, etc., etc. Or you have loose motion frequently, automatically body becomes weak. or you are not able to pass motion, lower abdomen pain and severe pain, you are not able to sit, you are not able to work, you are not able to concentrate on your work. Doctor, I am not even able to sit, I am now lately, it's lot of pain. Those are the other ways of knowing it. Or else patients can simply go down nutritionally and come to you like loss of weight, etc.
Okay, doctor, but still you say that if it goes unnoticed, it may prove to be...
Depending upon the cause.
Okay.
Depending upon, one, bleeding itself can cause a problem, but bleeding has underlying reason.
Okay.
For example, painless common reason will be the piles. Everybody would have heard piles or hemorrhoids, which is very 20 to 30% of the population suffer from, male or female, because of the constipation, lack of activity, lifestyle, or the food intake. Constipation is one of the commonest causes. Prolonged constipation invariably leads to piles, and many occasions with or without pain you can have blood silently coming, bleeding rectum, or any anus is just the last opening of the rectum. Any disease, fissure, fistula, abscess, anything can add to the problem, and you can have additional takes. Sometimes you go up, you can have disease of the intestines. Also, the blood in the rectum, bleeding in the rectum or rectal bleeding, it's not only red, sometimes it can be little different, darker color. It can be dark red, it can be maroonish color, or it can be black, jet black, like a tar, road tar, no? It is called tarry stools. It can be liquid, sticky, tarry, dark stools. The bleeding can be different, fresh red blood, just like a cut injury, or dark red, or maroonish, or very dark stools can be bleeding. So rectal bleeding has a different colors, different possibilities, all of them carrying equal significance, equal importance. So all the things come under the rectal bleeding.
Okay, doctor. So you elaborated how the disease is and all about it. So we would definitely like to know what are the main causes of such rectal bleeding.
Exactly. If it is very fresh and red, it is very immediate to the bleeding, say like piles, okay, or just a polyp in the anus, or just above the rectal polyps, or rectal inflammation, rectal infections. Sometimes infections like dysentery can also produce blood. If it is darker, it is little above in the colon, colonic polyps, colonic ulcers can produce these kind of bloods. You go further, maroonish, it is in the small intestine, very high up. Small intestine or right-sided colonic pathologies, polyps, diverticulum with infections can produce bleed. If it is tarry black, red black, it is coming from high above. When the blood is leaking and it has to go through several meters of the intestine to come out, it undergoes changes because of the acid medium, acid in the stomach, it becomes tarry and red. Patient may not notice it sometimes, or patient may come to you, sir, lately my stool is dark, but he will be comfortable. So you put your finger, check the area, see that motion color dark, then we think the bleeding is from top and go along to investigate it. But common causes will be simply like polyps, infection, inflammation, diverticulitis, piles, etc. Sometimes rarely a cancer.
Okay, doctor. So, is there any age difference that this category may have more chances of getting rectal bleed or?
As I told you, older people, they can have diverticulum. Diverticulum is a weak when the intestine walls become weak. Some parts start bulging out. Whenever there is a weakness, automatically there will be bulging out. That can come in older age. Colorectal malignancies, age is not the only criteria. It can happen at the age of 20. It can happen at the age of 60. Piles, even young people with constipation, fast food, low fiber diet, low residue diet, any age is possible. Polyps, more common even in children. Even children, because that is naturally occurring, polyps with bleed can happen even in children. Any age can happen. Children, particularly, they have this red currant jelly, jelly kind of things, can happen like that.
Okay, doctor. So now how do you evaluate a patient with rectal bleed?
When the patient says bleeding, obviously like a red only patient will say, I have blood, red blood comes. So that is obvious. The patient himself says it's easy. If says change of color, then as I told you, it has got different meanings. Ultimately, you check up your complete blood counts, hemoglobin, blood counts, all the things you check. An ultrasound of the abdomen to show anything outside. Your finger digital examination. Sometimes you can touch and pick up the diseases. And a small tubes are there called proctoscopy. We just put the touch, we can see in that 4-5 centimeters itself any problem there. Suppose it is little higher up, we have got a tube, flexible scope called sigmoidoscopy. The organ above the rectum is called sigmoid. So we put a tube and that area 60 centimeters we can check. Suppose there is nothing, then you go for a full colonoscopy. That tube is full 160 centimeters. You can enter, you can go through the entire colon right up to the terminal ileum. Full cycle you can see. Then most likely we will find out the reason. This is ulcer, inflammation, polyps, or a malignancy, or ulcerative colitis, Crohn's disease. I would like to say that ulcerative colitis and Crohn's disease are becoming more common and more identified than before nowadays, even in Bahrain, to a surprise. As I told you, TARI means it is above, it's come from high up. So you have to put an endoscopy through the mouth, esophagus, stomach, duodenum, check. Along the line you will find it. But somewhere in between there is an area called small intestine. Then we may have to do further different kind of investigations like enteroscopy, CT scan, bleeding scan, like that. But common reasons can be found out in the colonoscopy itself.
Okay. So doctor, you mentioned that there are many reasons associated with this disease, rectal bleed. So once the reason or the patient is evaluated, how do you manage the disease?
Yes, this all depends upon the cause, very cause. For example, it's piles. Common reason will be constipation. So improve the diet. Like any other diseases, diet is very important in gastroenterology or even in general overall health. Take high fiber diet, lot of vegetables, fruits, hydrate yourself, take more of liquids so the motion will be soft, and more vegetables, less meat, so that for the stool is very easy to pass. Once the stool is passing easily, most of the diseases in the anus or rectum like piles and other things will become better. Of course, specific treatments for piles, medicines, or for the fissure or for the fistula is there. And if it is still not improving, you have to go for a surgery to control the bleeding. This is one cause. Suppose a polyp during the colonoscopy, you can cut and remove it. If it is an innocent polyp, nothing to worry. If it is something sinister, then we have to go for further evaluations. Suppose it is inflammation, ulcerative colitis, Crohn's disease, then they have to go for long-term treatment. The treatment is very long-term, and periodically go to the doctor and check. Suppose it is some focal or small area infection, inflammation with antibiotics, etc., it will go off, dysenteries and things like that. If it is here, upper intestines like ulcer, bleed, etc., you have to give medicine. Any gastritis medicines you are taking, people are taking medicine for gastric. You take it for longer duration until the ulcer heals, that bleeding spots becomes normal like this. Then he has no chance of worrying about that. Rarely little more unusual causes can be there, like angio by birth or by nature, some abnormalities in the vessels can bleed. They are dealt with as per the conditions.
Okay, doctor. So you said that in some cases even a lifestyle change can help.
Yes.
Yes. So can you elaborate what is the future of this disease?
This is rectal bleeding is future is direct early. You have a doubt, you go for a complete evaluation. Nowadays, if you are 50 years old, even you don't have a rectal bleed, you go for a complete colonoscopy and gastroscopy to check, is it okay? Just like you are going for heart checkup. Even if you don't have it, you can go to a heart doctor, you can take an ECG, echo, TMT, okay, everything is fine. Like that, it is nowadays recommended people 50 years or above, Even if they have some vague symptoms, still it is advisable to go for a gastroscopy, mouth endoscopy and colonoscopy to check. The earlier you pick up, some of disease like cancer, the earlier you pick up better. Some of the diseases for which the treatment is available, you have to give the treatment and control it, like ulcerative colitis, Crohn's disease, etc. Some diseases are reversible. Piles you treat, it goes off. Fistula you treat, operate, goes off. Fissure you give medicine or surgery, goes off. If you have infection, give antibiotics, it goes off. Those diseases are not to be worried, but we don't know what is inside. The rectal bead is a tip of the iceberg. We don't know what is underneath it. Only after evaluation we can say confidently this is nothing to worry, you take medicine, surgery, etc. But until we know what is what, it has to be careful. The future is early diagnosis and immediate assessment of the reasons, and when it is possible to treat it.
Yes, doctor. So coming towards the end of this episode, what is that one takeaway message which you want the viewers to always remember?
As I told you from the start itself, I am telling, whether it is a drop or is a lot of bleeding, whether it is coming with stools or is it coming with constipation, whether it is coming with pain or without pain, you noticed it one day or it's happening frequently, don't bother. One drop is also important. It may be something serious inside, particularly if you are above 50 years. If you are above 50 years, even one drop, consult the doctor, rule out the difficult diseases, bad diseases, then you don't have to worry. If it's done, complete evaluation done, it turns out to be innocent cause, nothing to worry, particularly above 50. Below 50, doesn't mean you have to ignore it, but above 50 is very, very important.
Yes, doctor. So, dear viewers, always keeping in mind, early detection is quite important in this disease. So, with that note, let's come to the end of today's episode. Thank you very much, doctor, for being with us today to answering to all our questions. With this, we come to the end. Until we meet next time, this is Marina Francis signing off. Stay safe, stay healthy. Good night.